So Paula, you're 48 years young.
Yes.
What troubles did you have with your knees prior to the surgery that made you decide to look at the surgical options?
I had a lot of pain under my kneecap, and particularly at night. I had a lot of swelling and was really quite limited in walking. I really started to walk with a limp just before I had it done. It progressively got worse, but probably pain and swelling were the worst symptoms that I had.
And what made you decide that a realignment procedure was the way to go?
Well, when I saw Dr. Parker and we looked at the x-rays, and one side of the cartilage the inner side was actually all right, I thought, well, the knee replacement is so permanent, and I was really too young for the knee replacement, and we discussed that. So it was a good option for me, and I thought, well, I may as well do it while I'm young and healthy, and I'm not going to get all the other complications that you get as an older patient.
What would you say to people who are considering osteotomy?
I think you do need to consider one thing, is that it is quite a long rehab period. You are on crutches for 12 weeks, and you're in a brace for 6 weeks, and that is probably, I would say, the first 3 weeks are the hardest, and you have to make sure that you do have quite a lot of family support during that time. In terms of, you are very limited. You can't carry anything. You completely you're on the crutches, and you're completely dependent. So it's just that first 6 weeks, and then you're just gradually weight bearing until you're fully weight bearing at 12 weeks. So I think, A, make sure you've got some family with you. B, I think look into your leave entitlements, because you are off work for a considerable amount of time. I've had both legs done, so and I had 3.5 or 14 weeks off both times. I didn't really have any pain. Some people say pain is a feature of the operation. I had really good anaesthetists, so I didn't really have any pain after the operation. I'm very happy with it, and I'm not complaining about that at all. The benefits far outweigh any reservations you may have about that.
Paula, are you happy with the outcome of your surgeries?
Oh, hugely. It has absolutely changed my life, and I'd say to anybody who is healthy otherwise and has this limitation, if it really affects your life, that it's an option for you, that it's fantastic. It's fantastic. I went to Melbourne a couple of weekends ago and walked around Melbourne. I just could not have done that. I would have had to keep stopping. I mean, my husband was struggling to keep up with me. It has just completely changed my life.
Isn't it?